Hi. 1. Definitions. We talk about addiction to porn when a person repeatedly fails to control his or her own consumption of pornography despite the negative consequences that this can have on his or her daily life. Clinicians also speak of misuse of pornography. Indeed, the Latin root of the word addiction is addicere, to say to. The slaves of the Romans had no proper name, they were called by the name of the master of the house, they were said to so and so. The etymology of the word addiction expresses an absence of independence and freedom, slavery. Addiction manifests itself by a repeated impossibility of controlling one's behavior and by the fact of continuing this behavior despite knowing the negative consequences in the more or less long term. The concept of addictive behavior can concern both psychoactive substances, alcohol, tobacco, illicit substances, etc., and behaviors without psychoactive substances, gambling, screen, etc. Dr. William Lowenstein, addictologist and author of These Addictions That Govern Us, defines addiction as a disease whose characteristics are ineffective effort to get out of it and loss of willpower. 2. What does WHO say? In its preliminary version of the International Classification of Diseases (ICD-11), the World Health Organization recognizes compulsive sexual behavior as a impulse control disorder, but does not yet speak of porn addiction in the clinical sense of the term. This document should be officially applicable on January 1, 2022. When we speak of addiction to porn, it is therefore an abuse of everyday language as we speak of addiction to purchases or video games when it is a question of compulsion. These official documents are however not Bibles set in stone but rather a photo of the state of knowledge at a given time. Research is constantly evolving. We've been talking about this for years. A group of researchers from the University of Cambridge, United Kingdom, had published a study showing that the brain activity of sex addicts subjected to pornography was identical to that of drug addicts. They showed that this disorder manifests itself in the same way as addictions commonly accepted as such: alcoholism, drugs and cyberdependence. Illness or not, addiction to pornography can be defined as excessive use with loss of liberty and personal suffering due to the inability to control oneself. Permanent relapses. 3. How do you get addicted to porn? The pornographic compulsion can be seen, in the non-clinical sense of the term, as a behavioral addiction or drug-free drug addiction. Like addiction to products, it goes through a phase of discovery, a phase of habituation, a phase of abuse. It should not be confused with sex addiction, which is often the next stage. Discovery. The discovery of porn generally takes place in adolescence. We discover her body and her sexuality with the first orgasms. The other attracts, the body is in turmoil and the hormones tickle loudly. Then porn attracts out of curiosity. We look just to see. To know. All that is erotic contributes to this interest. Repetition, then habituation. The easy pleasure of orgasm that leads to erotic images will produce a real habit of consuming X movies. Little, by dint of repetition, discoveries of new practices and new sites, the internet user ends up falling into addiction. This addiction phase quickly became topical due to the disconcerting ease of access to pornography. In his living room, bedroom, from his phone. Where you used to have to go to buy a magazine, it is now just a click away. 4. What are the symptoms? If you are asking yourself the question, take the test: are you porn addicted? If you are wondering about a loved one, it is less easy to pin down. The person who is addicted to pornography continues to live a normal life. You may find suspicious handkerchiefs near the bed, recurrent searches for isolation, erotic or pornographic photos on the computer or in the trash, exorbitant phone bills, unexplained bank withdrawals, unexplained periods of irascibility due to self-shame, loss of self-confidence, the inability to have complete sexual intercourse, erectile dysfunction, premature ejaculation, etc., a will to always make love, or on the contrary an apparent lack of interest in the sexual domain. Attention, this list is to be taken with tweezers because taken one by one, these criteria mean nothing. It is necessary to speak, not to judge too quickly, to have a good capacity for the dialogue to arrive to speak about this dependence in a couple. 5. What forms can it take? There is not a single addiction but different types of sexual addiction, of which porn addiction is a form. Some will be addicted. Erotic stories. To porn movies. Striptease cam sites. To sex chats. etc. 6. What are the effects of such a mess? Here are some possible effects. Psychological isolation linked to self-shame. Loss of taste for simple things. Absence at the present time. Erectile dysfunction. Difficulty controlling sexually, premature ejaculation. Irascibility. Permanent sexual thoughts and fantasies. Isolation and degradation of dialogue in the couple, in the family. Attraction to increasingly extreme or deviant practices. In the most extreme cases, suicidal thoughts. 7. What to do to get out of it. Support by an addictologist psychotherapist. You can consult a psychotherapist specializing in addictology. You will find them in a private practice or a specialized care center. Learn about the areas covered by this or that center. Not all of them manage behavioral addictions. For example, it is possible to get in touch with addiction houses, but generally they do not deal with this behavioral disorder. If you can't get around, you can find online practitioners like addictologists, psychologists or sexologists. Note, the use of the title of state psychotherapist has been regulated since 2010. Are concerned, professional doctors of medicine, or holders of a master's degree in psychology or psychoanalysis. They must have validated additional training in clinical psychopathology. Document yourself and not be alone for the others. Document yourself, fight. The book associated with Stop Porn can be of great help to you to stop porn. You have to fight indirectly by taking care of your lifestyle, by seeing things from the good side and by fighting for life. 8. Conclusion. It is therefore necessary to be persevering and patient and to regain a taste for the simple things in life without turning to failures. No stress, trust yourself. Physical dependence will eventually subside over time. Pure weaning is therefore not an end goal. Often, when you think you've arrived, it's a relapse that follows. All this can go far. But by giving yourself simple and concrete means, it is possible to get out of dependence in the long term. In other words, regaining your inner freedom and learning to control your sexuality, your desires, your impulses. For further. Thank you for watching. Support us. Do not forget to subscribe in the channel.